Welcome to Medicine. Dr. Othniel Doolittle, CMO at Integritas, and here today with Dr. Naim, who is a burnout expert, has written a couple books on it, and has the company VS Vital Science, Vital Skills, where he travels around teaching and does burnout coaching for physicians and other healthcare leaders to help recognize burnout, treat, and coach them on get away from neglect, self-neglect, neglect of family, and prioritize the things that keep us mentally safe. So thank you again for coming. I love these talks. Resiliency versus self-neglect. How do you approach high-performing, driven ER doctors to understand the difference between resiliency and self-neglect when it comes to burnout and dealing with just a difficult career?
Well, first of all, thank you for having me. It's my pleasure, my privilege to be here. It's a very interesting question. It really depends on how people view resilience in their own minds. What is resilience for every person? The definition of resilience refers to the ability to adapt. It's not the strongest who survive, but the most adaptable. It takes a whole different value in medicine. And we are taught that being resilient means you do your job no matter what. That's the resiliency part, that nothing should break you. You must deliver no matter what. And those who fail to deliver no matter what are not resilient enough.
Right.
Our whole curriculum and studying is a test of resilience to make it through pre-med, med school, residency, and so on and so forth. You graduate after 13, 14 years. That is some sort of resiliency to get there. But that resiliency is defined by the ability to do your job, not take care of yourself. It doesn't matter how you arrive. What matters is that you arrive, and in there lies the difference. We're talking to ER docs or any docs to triage what's important. And along the path of our education and getting to the point where we want to get, we slowly start triaging our health and wellness and well-being. And it starts to get lower as far as the degree of importance. And we're taught, magnificently so, how to ignore all our signs and symptoms of, hey, I'm not okay, to get the job done.
You have to if you want to get the job done.
Right, and that's the thought process, no matter the cost. And so by the time we wake up to the cost, some of us, unfortunately, it ends tragic for us. The rate of suicide among physicians is 1 a day. And that's when they wake up to the fact that, okay, I've done everything that I have been asked for to get the job done, but at what expense? There's a great quote that says the price of anything is the amount of life you exchange for it. And by the time we get to where we need to be and graduate and be the ER physicians and high functioning, like you say, and getting people in and out and on top of our game and almost machine-like, we don't even know how to evaluate the cost of what we went through to get to where we are.
For us or for our families, we exchange our well-being, neglect our families, and it's sort of that rite of passage. Like, coming from a doctor's family, my mom told my wife, you do realize what it means for him to be a doctor. Like, he won't be home. He will miss things. And you've just got to be there for him. And my wife was like, oh yeah, I got it. I know the role. Neglect of this because something else has priority.
So there are a couple of psychologists who, when they talk about burnout, they talk about the 12 stages of burnout. They're Herbert Freudenberger and Gail North. And neglect, with revision of values and so on and so forth, they talk about 12 steps. It's about step 3 to step 5 of the gradual increase in burnout, or the signs and symptoms of burnout. So you are taught and expected to neglect, and the family becomes part of that I need to take care of the family also,
Yeah.
at my expense. So it becomes the whole I'm not just talking about patients. I'm talking about patients. I'm talking about my family. I'm talking about everybody that I love, that I need to care for. I gotta have to care for no matter what. And that no matter what is at our own expense.
This is exactly why I wanted you on and to talk to you more about this. We've had a few conversations over the years, and uh, I really enjoyed them and what you have done helping our healthcare leaders, our physicians, directors recognize burnout. We've had some great sessions. So how did you get started with VSVS and why did it get started?
It started with me recognizing that I was getting burnt out, and that was back in the early 2000s, with some of my symptoms of being frustrated or getting angry because patients didn't show up in the ER when I wanted them to, or they chose odd times of the night. So it frustrated me, and that's when I realized that I had to ask my aha moment: is why was I upset? Why was I frustrated? One thing led to the other, and I needed to find out, why am I feeling this way? I knew why I wanted to go to medicine, but why am I feeling this way? So in researching and in studying, I want to see how prevalent these things are, my emotions are. Are they common? Do other physicians feel them? And in the mid 2000s, not much literature was written about burnout the way it is now. So we started with the clues and then started reading some of the landmark books like Christina Maslach's Burnout. And I understood that, okay, this is the pathophysiology of burnout, and these are the symptoms, the causative factors. So there's a cause and effect, and it's actually a disease. But the next challenge was, okay, now that I understand the pathophysiology, how can I do something about it? And how can I target a group of people, us as physicians, who are notoriously very receptive to advice? And somebody telling them, hey, you might be doing things in not the best way possible, because that's usually an attack on who they are. And in came the idea of coaching, where the whole premise was, if I discuss with folks, I'm not telling you what's wrong with you because I don't need to, but let's discuss the data. Here's what's out there. 98% of the time, because there's nothing absolute in medicine, but 98% of the time people come to their own realization that, oh, yes, this is what I have. And I didn't have to tell them that. They came to that understanding. The next question is, okay, now what do I do about it? And how do I do about it? And so this is where the coaching part came in, because specifically when we're trying to change behavior and when we're trying to impact our lives, being the high achievers that we are, number one. Number two, our thought process is always about what's missing, what's wrong. We're deficit-based thinkers. So you really have to change the mindset of the physician from taking care of everybody to taking care of themselves. And the best way to do so was through coaching, and hence the name Vital Signs, Vital Skills, because it's something that resonated with physicians. Everybody understands vital signs. You walk in, you see the patient, their blood pressure is low, you know something is wrong, you're tachycardic, high fever, vital signs, their body's telling us something. So we help people recognize their own vital signs through their own symptoms. And then everybody has the vital skills needed to impact their vital signs. And the growth of those skills comes through by way of coaching.
I find it fascinating too because there are very few physicians that ask the question that you asked. Like you did that self-check, that self-analysis, and then pursued it. And it's we're not taught, nor are we recruited into medical school as growth mindset individuals.
Correct.
Just not asking, how can I do better? Like you said, it's very hard to coach physicians with feedback because anything that you're suggesting, even a study, even just this poor old lady was not happy with what you said, is like stabbing their heart, taking away their medical license. And it's that there's only one way to do it. I've been doing it this way forever.
Yeah.
It is coaching as the way to get through, is just asking the right questions and trying to draw physicians to that point where they can answer questions about themselves and see that self-assessment.
What physicians don't realize, there's a commonality in our calling, right? We all want to help, or for the most part, most of us want to help. And it's funny because no matter what culture you come from, no matter what background, no matter what medical school, what residency program, what specialty, we all end up thinking the same way. So that commonality, you just turn that analytical, I'm investigating kind of a mind with the instinct I want to fix, and turn it inwards, and fantastic things start to happen. And people get that permission not just from self. So one of the greatest things is when you're sitting down and having a conversation with, say, whether it's 12 physicians or 200 physicians, and they all come to the same realization, oh boy, we all suffer from this. There's a collective relaxation. As a matter of fact, if anybody wants to say, I don't think I'm burnt out, it becomes the opposite. It's like, of course you're burnt out. What are you trying to say or hide? So, be quiet. You're burnt out. You're like everybody else. So the taboo's gone. And now there's a collective safe space for people to start introspection and say, okay, yeah, I am like this.
Yeah.
And what can I do? I can't just claim the credit for myself. I've had help. I've been coached. And one of the strongest people that has impacted my life is my wife, who's a coach herself. She's a master certified coach. And she also taught me how to think. I raised the questions, but she taught me or showed me what's the best way to get the answers out of my own self and then out of others.
We have to have those powerful people in our lives influencing us.
Absolutely. You can't do it on your own.
Yeah. Well, I was talking recently with a physician about medical societies and how physicians in general have moved away from being involved in medical societies or just meeting together at all. And we're having this long, deep conversation. And I was like, hey, when's the last time on Facebook comments you had this deep of a conversation? And she was like, never. Like, yeah, like these conversations, these times of growth happen from relationships that you build. And I know this is a little bit of an aside from burnout, but you were saying that as a group, recognizing it together then gives you that permission that it's no longer taboo and we need to all work on this together. And then that camaraderie of, oh, you also get frustrated when a patient comes in at 2 a.m. with a seemingly crazy complaint. We're all there. Like, we know those ER patients, and it's one of my favorite coaching spots just because I'm like, do you understand about how shifts work? Like, they're not always on the same shift as you. So if they got off at 1 a.m., do you know how much gas money they just spent to come to the ER? Like, they don't live right next door. They came to you for a reason, and trying to shift that mindset. I love hearing about the support in your life and just that important aspect of us as physicians. If we're neglecting ourselves for our calling of saving patients, and we're not spending time with those relationships, family, friends, and developing that, colleagues, then we are trading our life away.
The whole concept of being a physician started with, it's a profession initially that started with those who are very well off. So it started as somebody doing a service to others. It was unethical for you to get paid as a physician. But those people who were physicians, they came from a place of comfort. They came from a place of knowledge, of depth, and they served people. And then when they were done, they went back to their lives that enriched them. Not so much the case here. And we become that physician no matter in everything we do. And so our profession started from the highest calling of helping others. and it was never meant to be. And while you do so, you perish. That was never the second sentence of medicine.
I find it fascinating just the financial discussion as well. Like, as healthcare right now in 2026 is starting this really tight margins and this collapse along a lot of strands, more and more physicians are saying, like, you do realize, like, we never were the ones making the money. Like, not in the heyday of healthcare, our pay hasn't changed in 30 years. We've been happy with this income, and the people making the money are the people that are causing this, and we're serving. We're gonna make a lot of money sometimes, but that's a not a reflection of most physicians' desire to hustle and desire for money. I was always told, if you want to make money, go into business. Don't go into healthcare.
Over 90% of physicians didn't become physicians so they can be rich or they can make money. Some wanted to do so, and that's fine. But over 90% wanted, the reason is to help. And that's why it's called a calling. It's a primal reason for them to help. This is what has pushed them through everything they've gone through to get the resilient part of being who they are. It's that calling. So the best reward for a physician, and don't take it from me, just ask physicians, isn't when they get that paycheck. Their best reward is when they get the patient's hug.
I have my little box of the very few thank yous that have ever come in patient cards. Tens of thousands of patients in, and a very small box, but it's so special to me more than anything else.
You know, I can probably guarantee you that there are more thank yous out there than we will ever hear, but they are. If we were doing this for the glory, nobody would stay.
Yeah.
We're doing this for the knowledge that you helped someone. So much so, we're our own worst enemy. Physicians are lousy at doing three things: recognizing success, celebrating success, announcing success, or sharing success. Like, if they do their job and they did a wonderful thing, they don't recognize it, they don't celebrate it, and they don't share it. Like, no, it's too embarrassing to talk about it.
We're much better at recognizing our failures.
Yeah, well, absolutely. Amongst ourselves and amongst colleagues.
It's a trained system. I mean, just talking about how we all go through the same medical system and we come out thinking the same, and we all practice in the same system, and we end up also thinking the same, which is this negative focus. And the patient experience score is not great job you're at. You got 96% of your patients happy with you. It's how did you not get from, like, those 96, they were pretty happy with you, but they weren't ecstatic. Like, what happened? You need to fix that, is the message we get. And we're already our own worst critics, and that just adds fuel to the fire.
And this is where we can help ourselves. This is where we can help each other. Whatever the government, the healthcare industry demands, and if it's pay per performance, because now we are a customer service based business. We're not just in the business of calling it a business is an atrocity, but that's what it is. But the demands that we have from ourselves, because we beat ourselves up all the time, we're never happy with what we have done. We're trained not to recognize it. We are trained to focus on what we haven't done. And so that shift needs to start from within. And we need to have compassion for ourselves and gratitude for ourselves and say, I am human. I have done my best. Some days I'm going to excel, and some days I'm going to be okay. And that's also fantastic. And start to spread that message. If I don't have compassion for myself, I can't have compassion for others. So accepting who I am and celebrating who I am allows me to accept and celebrate and hug and enjoy and empower and uplift and be there and support. All of these things we don't know how to do.
I love that reframing of our priorities and how that makes us better at doing what we love, which is developing ourselves to be compassionate caregivers, and being able to give our full selves and be happy with what we're giving of ourselves to our patients, but then to our family, to our relationships.
Learning how to give permission to yourself to be human is a breakthrough mindset. And those who master it are happy people.
So at BSBS, you have webinars and conferences that you do, and then also coaching. Is that always one-on-one, or what other things do you offer?
I have to give a shout out to you and Integritas, and I'll tell you why. I've been in this arena for 12 years, and I have tried to get this message across to people. The outline of my nose graces many doors that have slammed in my face, and that's okay. But every now and then, we see the people that come to us and say, hey, I want to do things different. I want to help. I want to support. I want to help grow. And visionaries is what I call them, because these are the people who know that medicine and their doctors require something different now. And you are one of them. And I have been very fortunate to sit down with you one-on-one and with the group of leaders that you have and talk about all of these topics. And so we do the group coaching or the group discussions and the one-on-ones, and they are such a delight. And for us, it's such a privilege to be in the presence of other docs when we talk about these things. And so I do congratulate you for being that pioneer and for realizing and doing something that other people still refuse or don't acknowledge, but they are on their way to do so. So I want to thank you. Integrit has been a big part of the impact of VSVS and my own growth. So thank you.
You're welcome. And again, it's what I love to do. Just find people like you who are passionate about helping clinicians do better. And not only that, it's been so much fun to have those sessions where healthcare administrators, the CNOs and the ER managers and directors, and they're sitting there and they have the same symptoms. They're in the same system. Our healthcare system is producing exactly what it was designed to produce, and it produces it all throughout the entire system. And it's just been so much fun to hear them grow as well, and the physicians grow, and then being able to have those open discussions with our administrative teams.
Yeah.
Really enjoyed it. And you're a very good coach, asking really good questions and probing and helping people grow.
I had and I continue to have two wonderful role models in my wife and our partner, Zaina and Relly. So they've taught me a lot.
That's awesome. Well, thank you so much for getting on and chatting with me a little bit about burnout. There's so much more we could talk about. Every topic that we've just barely touched on. I know that some of our group sessions and our ED directors and I sitting down and talking with you, those sessions have been just full of ways that we can either do self-assessments, things that we can do to reprioritize things. And you've just been very instrumental in those discussions in making sure that we're setting up our own directors at Integritas for success and creating an environment where our clinicians can thrive. And then also just trying to recognize burnout. It's been helpful as a physician leader to be able to know how to ask the right questions and have a resource that I can send people to as well.
Thank you.
So thank you so much. And
Appreciate you.
we'll have some more discussions for sure.
And I look forward to it.